video tuh balik tuh. Ini jahat. Aduh, video thứ là bài gì? Yonda đã đồn đấy của mình kia này để ảo ta. Dia bay ba. Đây là cái
Taruh aplikasi dulu ya. Harapan ya. Kita kuliah ya.
Tiap, tiap, tiap. Yuk.
Hindi lama ya, Kek.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. We're delighted to welcome you to the visiting lecture from Silliman University, Philippines, to Stikes Alifa Padang, West Sumatra, Indonesia. First, let us thanks to Allah Subhanahu wa Ta'ala who gave us blessing and health during this fortunate time. And not to mention, we also want to send our prayers upon him, Rasulullah Sallallahu Alaihi Wasallam, and his progeny. I'm Atila Aulia, the Master of Ceremony for our program today. This visiting lecture is presented by the Committee of Stikes Alifa Padang. The Honorable, the Head of Yayasan Pendidikan Alifa Nur Ikhlas Padang, Haja Fadmi Arma, the Council members. The Honorable Professor Barbara Lynn Egalves, PhD RN, from Silliman University, Philippines. The Honorable, the Head of Stikes Alifa Padang, Ibu Dr. Ners Asmawati MCAP, and the Council. The Honorable, the Head of Study Programs and Head of Units in the Alifa Padang Health Science College. The Honorable to all lecturer and staff of Alifa Padang Health Science. We welcome all the participants of this event. Ladies and gentlemen, the first agenda, let us recite Asmaul Husna.
Serius lah ya. Astaghfirullah, 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 astaghfirullah. Astaghfirullah. Asyhadu an la ilaha illallah. Astaghfirullah. Wa asyhadu anna Muhammadan Rasulullah. Astaghfirullah. Aku bersaksi tiada Tuhan melainkan Allah dan Muhammad utusan Allah. Faya ayyuhar rajuna minhu syafa'atan sallu alaihi wa sallimu taslima. Allahumma salli wa sallim wa barik alaihi wa alihi. Ya Allah, aku berlindung kepada Allah dari godaan syaitan yang terkutuk. Dengan nama Allah yang Maha Pengasih lagi Maha Penyayang. Hanya milik Allah Asmaul Husna. Maka bermohonlah kepadanya dengan menyebut Asmaul Husna. Dan tinggalkanlah orang-orang yang menyimpang dari kebenaran dalam menyebut nama-namanya. Nanti mereka akan mendapat balasan terhadap apa yang mereka kerjakan. Ya Allah, Ya Rahman, Ya Rahim,
يا قدوس يا سلام يا مؤمن يا مهيمن يا عزيز يا جبار يا متكبر يا خالق يا بارئ يا مصور يا غفار يا قهار يا وهاب يا رزاق يا فتاح يا عليم يا قابض يا باسط يا خافض يا رافع يا معيز يا مذل يا سميع يا بصير يا حكم يا عدل يا لطيف يا خبير يا حليم يا عظيم يا غفور يا شكور يا عليم يا كبير يا حفيظ يا مقيم يا حسيب يا جليل يا كريم يا رقيب يا مجيب يا واسع يا حكيم يا ودود يا مجيد يا باعث يا شهيد يا حق يا وكيل يا قوي يا متين يا ولي يا حميد يا محصي يا بديع يا معيد يا محيي يا مميت يا حي يا قيوم يا واجد يا ماجد يا واحد يا صمد يا قادر يا مقتدر يا مقدم يا مؤخر يا أول يا آخر يا ظهير يا باطن يا والي يا متعالي يا بر يا تواب
يا منتقم يا عفو يا رؤوف يا أحد يا مالك الملك يا ذا الجلال والإكرام
يا مقسط يا جامع يا غني يا مغني يا مانع يا ضار يا نافع يا نور يا هادي يا بديع يا باقي يا وارث يا رشيد يا صبور يا الله 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 يا الله.
For a moment, we would like to invite you to rise and sing Indonesian National Anthem, Indonesia Raya, and hymns of Stikes Alifa Padang. Para hadirin yang berbahagia, marilah kita menyanyikan lagu kebangsaan Indonesia Raya dan himne Stikes Alifa Padang yang akan dipandu oleh Usvia Rise Yolanda. The audience, please be stand.
Sekolah tinggi ilmu kesehatan Alifah Padang, citramu ku banggakan, tempat gapai cita-cita, alma mater pilihan, cari ilmu berguna. Namamu terukir indah di dalam relung jiwa. Stikes Alifah Padang, tunaikan tugasmu mulia. Tingkatkan karya karsa, cerdaskan tunas bangsa. Pembina dan pendidik mengabdi tulus setia, dengan iman dan takwa laksanakan tridharma. Mahasiswa berbenah diri, jadi kader profesional, sungsung masa depan gemilang cemerlang. Stikes Alifah Padang jaya selamanya.
Para hadirin dimohon duduk kembali. Now, I would like to invite Dina Permata Bunda to lead the Quran recitation. Acara selanjutnya, pembacaan kalam ilahi oleh Dina Permata Bunda.
Assalamualaikum warahmatullahi wabarakatuh. A'udzu billahi minasy syaithanir rajim. Bismillahirrahmanirrahim. Ya ayyuhan nasu qad ja'akum mau'izatum min شفاء في الصدور وهدى رحمة للمؤمنين. قل بفضل الله وبرحمته فبذلك فليفرحوا هو خير تجمعون. الله لكم بالرزق فجعلتم منه حراما وحلالا قل الله أذن لكم أم على الله تفترون. قل الله أذن لكم أم على الله تفترون. صدق الله العظيم. Assalamualaikum warahmatullahi wabarakatuh.
Ladies and gentlemen, please welcome Tari Pasambahan performed by Stikes Alifa student. Para hadirin yang berbahagia, marilah kita saksikan Tari Pasambahan
Seiring jalan Jabarada, Barada lalu tatian mandi. Seiring salam bersamba, salam lalu tatian kembali. Ampun dari kami yang muda mata, pasambah kami tarikan basahnya. Seiring kami salamkan nanjo samba, untuk tamu nang tiba. Burung norak burung ngari, menari-nari dia teh pamatang, sirih galak pinang menari. Nandari kami haturkan. Aduk dek kami nan parampuan, jotamu nalah tiba. Kami hidangkan tari persambahan, bakanan tamu menerimanya. Dia teh hari nan lah kimpe, sadang rancak bunga kambang. Hari persambahan nan kami angke, ada orang Minang nandang nyambut kamu nan lah datang. Kurang pada akan kau padamu. Kurang tadi orang punya cinta. Salam kurang kami haturkan.
To begin the event with the blessings, I would like to invite Mr. Irwan Chandra to lead the doa recitation and a moment of silence. Acara selanjutnya, pembacaan doa yang akan dipimpin oleh Irwan Chandra. Kepada Irwan Chandra, disilahkan.
Padahal menurut agama bisa. Menurut agama nalo di jane setuju. Nah setuju mas. Tak terkecuali saya nalo. Beliau coba hal tentang musik.
Assalamualaikum warahmatullahi wabarakatuh.
Kepas itu wajah ya.
Good morning everyone. My name is Irwan Chandra. I will lead for the dua today. I will pray in bahasa. Bapak Ibu yang saya hormati, mohon izin. Sebelumnya, marilah kita menundukkan hati dan kepala sejenak. Saya berdoa Allah Subhanahu wa taala agar acara kita ini dapat menjadi momen berharga bagi kita semua. Saya akan memimpin doa ini berdasarkan ajaran Islam dan silakan marilah kita awali dengan membaca Ummul Quran Al-Fatihah. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Hamdan syakirin, hamdan na'imin, hamdan yuafi ni'amahu yukafi mazidah. Ya Rabbana lakal hamdu kama yanbaghi li jalali wajhikal karimi wa azimi sultani. Allahumma sholli ala sayyidina Muhammad wa ala ali sayyidina Muhammad. Ya Allah ya Tuhan kami mengucapkan puji dan syukur kehadirat-Mu atas segala rahmat dan karunia-Mu yang telah Engkau limpahkan kepada kami, kepada para pemimpin kami, kepada masyarakat dan negara kami. Ya Allah, Engkau yang telah memberikan kami kesempatan untuk bersama-sama dapat berkumpul di tempat ini untuk melaksanakan satu kegiatan yang insya Allah kami harap mendapat berkah-Mu. Kami sangat memohon izin-Mu agar kegiatan ini dapat berjalan dengan baik, dapat menjadi pencerahan bagi kami atas sesuatu yang belum kami ketahui. Serta kami memohon ridho-Mu agar kegiatan ini dapat memberikan manfaat yang besar bagi kehidupan kami, orang di sekitar kami, masyarakat dan negara kami. Ya Allah Tuhan yang Maha Bijaksana, kami berharap agar acara seminar yang diberi tema Care of Women with Complication of Pregnancy ini sukses dan bermakna. Buatlah suasana yang kondusif dan berikan pemahaman yang mendalam kepada peserta. Semoga setiap sesi menjadi wadah bagi pertumbuhan dan inspirasi sehingga kami semua pulang dengan pengetahuan yang berharga. Ya Allah Tuhan yang Maha Pemurah, karuniakanlah kepada kami ilmu yang bermanfaat, ilmu yang dapat membimbing dan menjaga kami dalam kehidupan ini, serta jauhkanlah kami dari sesuatu yang sia-sia. Ya Allah, tunjukkanlah pada kami apa yang masih kabur dalam pikiran kami, serta berikanlah kami cahaya atas ilmu yang Engkau berikan. Ya Allah yang Maha Pengampun, ampunilah dosa-dosa kami, dosa para pemimpin kami, dosa guru kami, dan dosa kedua orang tua kami. Berikanlah mereka kemudahan dan petunjuk dalam melaksanakan tugas yang Kau berikan sesuai dengan Al-Quran dan Al-Hadis. Allahumma inna nas'aluka salamatan fid din wa afiatan fil jasad wa ziyadatan fil ilmi wa barakatan fil rizki wa taubatan qoblal maut wa rahmatan indal maut wa maghfiratan ba'dal maut. Allahumma hawin alaina fi sakaratil maut wa najatan minan nari wal afwahinal hisab. Rabbana la tuzigh qulubana ba'da idh hadaitana wa hab lana min ladunka rahmatan innaka antal wahhab. Subhanallah, subhana rabbika izzati amma yasifun, wassalamu alal mursalin, walhamdulillahi rabbil alamin. Wassalamualaikum warahmatullahi wabarakatuh.
We are now going to listen to the welcome speech delivered by the head of Stikes Alifa Padang. Hadirin yang berbahagia, marilah kita dengarkan kata sambutan yang akan disampaikan oleh Ketua Stikes Alifa Padang kepada Ibu Dr. Nels Asmawati MKep. Silahkan.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning and greeting to all of us. The Honorable Ibu Hajah Fatmi Armah SKM, Chairperson of the Alifa Nur Ikhlas Padang Education Foundation and the Council members, the Honorable Speaker, Ms. Barbara Lin Galvez, PhD LN, College of Nursing, Silliman University, Philippines. Welcome and thank you for accepting your invitation. The Honorable Stikes Alifa Padang, structural leaders, the lecturers, and the entire academic community of Stikes Alifa Padang, Bapak Junedi, lecturer Muhammad Nasir, University Bukit Tinggi. Terima kasih Pak Jun sudah memfasilitasi Stikes Alifa Padang, alma mater tercinta. Aplaus dong buat alumninya. Okay. The next committee visiting all lecturer, especially visiting lecturer attendants, ananda kami yang berada secara langsung maupun tidak langsung dan yang ada di YouTube ya, via YouTube. Alhamdulillahirrabbilalamin, puji dan syukur kami panjatkan kepada Allah Subhanahu wa taala atas limpahan rahmat dan kasih sayangnya. Kita diberikan nikmat iman, nikmat kesehatan, dan nikmat kesempatan kita berada di majelis ilmu pada hari ini untuk mendengarkan materi dari narasumber kita dalam kuliah tamu yang sangat spesial ini yang menghadirkan narasumber dari Filipina. Salawat beriring salam kita panjatkan kepada junjungan kita Nabi besar Muhammad Sallallahu Alaihi Wasallam. Ladies and gentlemen, all the leaders, commit and academic community of Stikes Alifa Padang would like to express our graduate and highest appreciation to all of the participants who have attended our visiting lecture, because we will listening to material in the visiting lecture care of women with complication of pregnancy. Ladies and gentlemen, and respected guests, starting with this remark, all us to present to profile Stikes Alifa Padang, West Sumatera. Stikes Alifa Padang under the auspice of the Alifa Nur Ikhlas Padang Education Foundation, established 2005, has a vision becoming a health college with excellent character, entrepreneurship, and national competitiveness in 2003. We are committed to continuously improve the quality of higher education beyond the national standards for higher education and continue to stratify towards the international level. Currently, Stikes Alifa Padang has achieved an excellent. Applause buat Stikes Alifa Padang. Accreditation rating from Badan Akreditasi Nasional Perguruan Tinggi. In this momentum, we are very proud to be able to create an academic atmosphere at Stikes Alifa Padang. The theme will be discussion now is highly relevant to development of global health science. The visiting lecturer is a program the Stikes Alifa Padang can relate on to improve quality and quantity in various academic fields, especially research, teaching, and innovation. And the general objective of this visiting lecturer is to increase the number offering lecturer at Stikes Alifa Padang, expand international network, and to increase the number of collaborative research so as to improve the performance and reputation of Stikes Alifa Padang abroad in order to achieve international recognition. Thank you again to the speaker who are outstanding expert in their fights, who are willing to share their knowledge with Stikas Alifa Padang. Semangat buat Ananda semua. Selamat mengikuti kegiatan ini sampai selesai. Terima kasih kepada seluruh panitia yang sudah mempersiapkan kegiatan ini dengan baik. Terima kasih kepada Ibu Ketua Yayasan Pendidikan Alifa Nur Ikhlas Padang beserta Ibu Pengurus Yayasan Pendidikan Alifa Nur Ikhlas. Izin berkenan kepada Ibu Ketua Yayasan Pendidikan Alifa Nur Ikhlas Padang untuk memberikan sambutan dan membuka kegiatan ini secara resmi. Izin memberikan pantun. Cakep ya. Bunga melati sedang berkembang. Tumbuh indah di atas jambangan. Gembira hati terasa riang. Hadirin datang penuhi undangan. Datang belajar di hari cerah. Senin Kamis membawa berkah. Jangan ragu, jangan khawatir. Stikas Alifa selalu di hati. Billahi taufik wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
Maksudnya ceritanya nggak cerita gimana?
Hadirin yang berbahagia, marilah kita dengarkan kata sambutan sekaligus membuka acara ini secara resmi yang akan disampaikan oleh Ketua Yayasan Pendidikan Alifa Nur Ikhlas Padang. We are now going to listen to the welcome speech given by the head of Yayasan Pendidikan Alifa Nur Ikhlas Padang and to officially open the event. Ladies and gentlemen, please welcome Ibu Haja Fatmi Arma SKM. The floor is yours.
Assalamualaikum warahmatullahi wabarakatuh. Kurang semangat, coba ulangi. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Terima kasih. Yang kami hormati Ibu narasumber, visiting lecturer, Ibu Profesor Barbara Lin. Maaf, PhD LN dari College of Nur Silliman University Filipina. Selamat datang di Ranah Minang, Padang Kodam tercinta. Ibu Ketua Stikas, staf dosen, karyawan, karyawati Stikas Alifa Padang, Bapak Ibu undangan yang kami muliakan, teristimewa mahasiswa Stikas Alifa Padang yang berbahagia yang sudah hadir dalam ruangan ini. Puji syukur kita panjatkan kehadirat Allah Subhanahu wa Ta'ala atas rahmat dan karunia-Nya kita dapat berkumpul bersama dalam rangka acara visiting lecture yang diselenggarakan oleh Stikas Alifa Padang. Salawat dan salam kita kirimkan kepada Nabi Muhammad Sallallahu Alaihi Wasallam. Bapak, Ibu undangan yang kami hormati, izinkan saya sedikit menyampaikan tentang profil daripada Yayasan Pendidikan Alifa Nur Ikhlas Padang. Yayasan Pendidikan Alifa Nur Ikhlas Padang sebagai penanggung jawab institusi pendidikan kesehatan saat ini telah berusia 19 tahun dan saat ini Stikas Alifa mempunyai 5 program studi, prodi keperawatan, prodi kesehatan masyarakat, prodi pendidikan profesional dan prodi pendidikan profesi bidang. Untuk meningkatkan mutu pendidikan di perguruan tinggi serta menghasilkan lulusan yang profesional, maka yayasan selalu mendukung program yang dibuat oleh Stikas, diantaranya pengembangan sumber daya manusia, salah satunya dengan pertemuan ilmiah internasional serta diseminasi hasil penelitian yang disajikan setingkat internasional. Program studi Stikes Alifah Padang sudah terakreditasi baik dan baik sekali. Stikes Alifah Padang merupakan salah satu perguruan tinggi kesehatan swasta yang memiliki komitmen untuk proaktif terhadap pengembangan ilmu kesehatan dan selalu berupaya agar ilmu-ilmu tersebut dapat disebarkan dengan merata, tidak hanya di lingkungan kampus, tetapi juga kepada masyarakat. Program visiting lecture ini menjadi program yang dapat diandalkan oleh Stikes Alifah guna meningkatkan kualitas dan kuantitas dalam berbagai bidang akademik, khususnya riset, pengajaran, dan inovasi. Program ini dimulai dari peningkatan kualitas riset, pengajaran, dan inovasi dalam lingkup fakultas. Jumlah dosen asing di Stikes Alifah Padang dapat dilakukan dengan mengundang pihak asing sebagai dosen tamu, dosen penguji, dosen pembimbing, serta mempromosikan staf pengajar atau peneliti Stikes Alifah keluar sebagai potensi pengembangan kerja sama dalam bidang pengajaran maupun penelitian kolaborasi. Semua pencapaian ini adalah hasil kerja keras kita semua, baik yayasan, dosen, tenaga kependidikan, dan mahasiswa. Besar harapan kami untuk kedepannya, Stikes Alifah bisa lebih meningkatkan kualitas mutu pendidikan. Salah satunya dengan bekerja sama institusi baik di dalam negeri maupun di luar negeri. Yayasan memberikan peluang kepada seluruh staf, baik dosen maupun tenaga kependidikan, untuk melanjutkan pendidikan yang dibiayai dari dana yayasan. Dosen Stikes Alifah Padang pada saat ini berjumlah 50 orang yang semuanya sudah bergelar magister. 90% dari jumlah dosen yang ada didanai oleh yayasan. Serta ada 5 orang sedang melanjutkan program S3, 3 orang sedang melanjutkan studi di Lee Collins University Malaysia, 1 orang dosen melanjutkan studi di Universitas Gajah Mada, 1 orang di Universitas Andalas. Alhamdulillah 4 orang dosen Stikes Alifah Padang sudah menyelesaikan program doktor. Yayasan berharap pada tahun 2026 30% dosen sudah menyelesaikan studi S3 hendaknya. Bapak Ibu yang berbahagia, pada kesempatan ini kami ucapkan terima kasih kepada narasumber yang sudah berkenan hadir pada hari ini. Profesor Barbara dari College of Nursing Silliman University Filipina yang telah berkenan hadir di Stikes Alifah Padang. Tak lupa kami ucapkan terima kasih pada pimpinan Stikes Alifah Padang beserta jajaran serta panitia atas dukungan dan kerjasama yang telah diberikan demi kelancaran seluruh rangkaian kegiatan ini. Tiada kata yang dapat kami sampaikan selain doa, semoga jerih payah dan dukungan Bapak Ibu menjadi amal di mata Allah Subhanahu wa Ta'ala. Banyak maaf dan terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.
Ladies and gentlemen, please allow me to translate the speech. Respectable guests, Alifah Nur Ikhlas Padang Education Foundation, as the person in charge of the Alifah Health Science College, is currently 19 years old and currently has 5 study programs, which are the Nursing Study Program, the Public Health Study Program, the Midwifery Study Program, the Nurse Professional Education Study Program, and the Midwife Professional Education Study Program. To improve education in universities and produce professional graduates, the foundation always supports programs made by Stikes Alifah, including human research development, one of which is held international scientific meetings and dissemination of research results presented at the international level. The study program at Stikes Alifa Padang is well accredited and very good. Stikes Alifa Padang is one of the private health college that has a commitment to be proactive in the development of health science and always strives so that this science can be disseminated evenly not only in the campus but also to the community. This visiting lecture program is a program that can be relied on by Stikes Alifa to improve quality and quantity in various academic fields, especially research, teaching, and innovation. This program starts from improving the quality of research, teaching, and innovation within the faculty. The number of foreign lectures at Stikes Alifa can be done by inviting foreign parties as guest lecture, examiners, supervisors, and by promoting Stikes Alifa's teaching staff out as a potential for developing cooperation in the field of teaching and collaborating research. All these achievements are the result of the hard work of all of us, both foundations, lecturers, education staff, and students. We hope that in the future, Stikes Alifa can further improve the quality of education, one of which is by collaborating with institutions, both domestically and abroad. The foundation provides opportunities for all staffs, both lecturers and education staff, to continue their education funded by foundation funds. Stikes Alifa Padang lectures at the time numbered 50 people with master's degrees. 90% of the number of lectures were funded by the foundation. And there are 5 people who are continuing the doctoral program, where 3 lecturers are continuing their studies at Lincoln University, Malaysia. 1 lecturer is continuing his studies at Gajah Mada University, and 1 lecturer at Dallas University. 4 lecturers of Stikes Alifa Padang have completed
much. The Secretary, Mrs. Hadja Erwani, the head of Alifa Health Science College, Dr. Asmawati, Dr. Desi Starly, the vice head of Alifa Health Science College, and lastly, but not the least, Mr. Junaidi Rustam, who is the vice rector of Muhammad Narte University. Ooh, those were difficult names to pronounce. So, Mr. Rustam and Dr. Desi were very responsible for my coming here to your university. So I'm glad, and it's a pleasure for me to be with you to share my knowledge on maternal and child nursing. Yesterday, I was in Bukittinggi for my lecture in child care across the lifespan. This time, I will talk about the maternal complications. So can we start? Okay. Sorry? Okay. So I am instructed to give a welcome speech. So, like I said, it has been a pleasure to come here to your country. This is the first time I have been to Indonesia and the first time I have been to Padang and Bukittinggi. So it's not really different from the Philippines because as neighboring countries, we have the same warm, accommodating people, and the food is good. I like nasi padang. I have tasted it, and I feel so comfortable coming here because of the people who are very accommodating, warm, and beautiful. Thank you so much for inviting me here to your country. And this will not be the last because I would like to come back later on lecture series. Thank you so much.
Now we would like to invite the speaker to have photo session. Sebelum acara inti dimulai, kami meminta kesediaan narasumber, Ibu Ketua Yayasan beserta jajaran, Ibu Ketua Stikes beserta jajaran untuk berfoto bersama.
Agak baru ni kan. Ini lah itu sekarang tak nyisi lo. Ada mana? Saya dah dulu. Ada ni enam. Lama. Itu ampe enam.
Kepada seluruh dosen dan para staf, silakan untuk mengambil tempat.
Jadi tiga dan
Banyak anak dolan-dolan kesehatan di sikon Pak.
Ya sudah apa? Saya ceramah. Apa? Udah di mana orang doa nih? Enggak lah di sekarang. Oke, mendua melepih budaya wak lagi. Apa aja cari mama ada. Nah, kau mereka ada cari mama ada tapi Tuhan. Mama itu mama saya. Termasuk orang telah menun. Kalian yang beres-beres. Memang itu hanya tidak tahu. Nah, aku kalau nih kilau kalau keluar main tuh yang dia di main di. Jangan jali mau mie. Pincik mato kan nasi goreng kalau mato pipi lataan. Apa aku ya. Kalau nih kilau itu tidak tahu dong. Bubu-bubu nyala dah. Bu aku habis pipi nak nerima. Udah tak bisa aku dah. Kalau itu
masih foto sama biar aja. Ladies and gentlemen, we have come to the core of our events, that is to hear the insightful speech from our respectable speaker. The session will be moderated by Narisa Afifa. Narisa Afifa is an outstanding nursing student. She got the best oral at an international seminar in Lincoln University, Malaysia.
Oh God.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. I'm Narisa Afifa, the fourth year nursing student from Stikas Alifa. I'm moderator of today's visiting lecture event. Today's topic about care of women with complication of pregnancy. Pregnancy complications are health issues that may arise during pregnancy. In pregnant women, due to pregnancy complications that often occur are bleeding, hypertension, sepsis, and disorder of the circulatory system. Maximum care during pregnancy need to be done to prevent pregnancy complications. Therefore, we invite speakers who are expert in their field who will explain to us how to care of women with complication of pregnancy. Ladies and gentlemen, let me introduce our speaker, Professor Barbara Lynn Galvez, PhD RN Cis, College of Nursing in Silliman University. I will explain to all of you about Professor Barbara curriculum writing.
Nak jauh itu nak boleh yang tentu kena buat luar. Poda ada poda ada liu. Pada cak makan awak dua hari tak gitu dah. Tanyai. Tu ngapa dah?
Okay, Professor Barbara, graduate PhD in Nursing International Program from Prince of Songkla University Hat Yai Songkla, Thailand, class of 2021. And Master of Art in Nursing, major in Maternal and Child Nursing, Silliman University, Philippines, class of 2001. She also participated as professional organizations, Philippine Nurses Association, Maternal and Child Nursing Association of Philippines, Associate Editor, Belitung Nursing Journal. Some of the awards she received recognition for loyal and faithful service with humility and dedicated teaching, Silliman University 2011. And she also joined International Nursing Conference, participated in several international publications that have been published. Now, please welcome to our speaker, Professor Barbara Lynn Galvez, PhD RN. Give big round of applause to her. All right, before the presentation begin, let me inform how the presentation will be going on. The first one, Professor Barbara will be invited to present the material, and after that, there be question and answer sessions and quiz, and followed by conclusion. Acara pertama yaitu penjelasan materi oleh Profesor Barbara, dan sesi selanjutnya sesi Q&A dan quiz, dan diakhiri oleh conclusion. To Professor Barbara, the time is yours.
Thank you. So much introduction. So we can start now with the proper lecture. So complications of pregnancy are health issues that may arise during pregnancy, affecting the well-being of both the mother and the fetus. Now, the main principle of maternal and child nursing is to actually enhance the well-being of both the mother and the child. Meaning you have to take care of the baby as well as the mother. In fact, you don't only take care of the mother, you take care of the family as well, because they will be present in the hospital during the mother's delivery. Stop. Okay, I will continue. So how is this used? Not working. Okay. Okay. So these complications actually stem from pre-existing health conditions, meaning from pre-existing, the mother has already the high blood pressure or diabetes even before pregnancy happens. And it gets worse when the mother is already about to deliver. So the best thing to do is to seek proper healthcare before and after pregnancy, because this is very crucial. Crucial meaning very highly critical to minimize the risk of such complications. Now, women who are 35 and above are the candidates for complications of pregnancy. So it means I am not worried with Indonesians because you get married early in life. Around 25 years old, you already begin to settle down and then get pregnant after a year. But no, it is always important that you have to seek health care for your pregnancy. Now, what are the leading complications of related directly to pregnancy? Now, this refers to health problems that arise specifically due to conditions of being pregnant. Now, like for example, a woman does not have diabetes all her life, and when she got married and started to get pregnancy, diabetes no, starts to have developed. And you call that gestational diabetes. The same with increased blood pressure. There is such a thing as pregnancy-induced hypertension because especially among the poor or low-income families, they like to eat salty foods. Okay? So when they become, when they accumulate all the sodium in their body, then they get to bloat. Bloat means as if they are fat, but they are not fat because the accumulation of sodium in the body will cause shifts of fluid in the intracellular to the extracellular spaces. So they will have edema. Okay? So these complications directly affect the pregnant woman and may impact the well-being of both the mother as well as the developing fetus. So these issues are intricately tied to physical and hormonal changes that occur during pregnancy because the woman's body is confused. No, the hormones are actually confused. So the body is reacting to the hormone changes. Because when a woman is pregnant, the first hormone that is affected is the human gonadotropic hormone. If you have high HCG levels, that means you are pregnant. Okay. I will still continue. Okay. So, if a woman plans to get pregnant, stand up. Ayan. So when a woman plans to get pregnant, then the first thing that she will have to do is go to the prenatal clinic for assessment. Okay? She will have tests, no, like laboratory tests to check her condition. Now, this is very important because no, prenatal visits can be seen already if the mother is or has complications. Now, like for example, pain. No, pain is not actually present in all of pregnant women. But if there is pain, there is some problem. Again, the vaginal symptoms like leaking fluid. What is the meaning of a leaking fluid? That means that the bag of water is ruptured. See? So if the bag of water is ruptured, then the woman starts to go on labor. And that is not yet the time for her to deliver the baby. Another one is bleeding. Bleeding should never be present in any trimester of pregnancy because when there is bleeding, that means there is something wrong, which is miscarriage or abortion. See, even a small spot of blood will mean a big deal to the woman. Okay. Another one is provide enough time for thorough assessment or history taking so the nurse can discover and investigate exhaustively, such as headache, no, blurred vision, back pain. So what is the meaning of all of this? Headache, blurred vision, and back pains. Blurred vision and headache can be a cause of high blood pressure. Now with back pain, it can be ectopic pregnancy. Okay? And then review the different signs or danger signs of pregnancy. What are the different danger signs of pregnancy? Like I have mentioned, you have bleeding, you have, sorry, I thought you were answering. So there are danger signs that you have to watch out for, no? When a woman is pregnant. And then you have to assure, as a nurse, we have to assure that she is free to call the physician or any other health provider who is present in the clinic. Now, the nursing diagnosis, no, encompasses both the physical issues present in the woman and also the family. The family is included in the plan of care. See? So these are the different diagnoses that you can have for pregnancy when there is complication. One, anxiety. Two, you have risk for infection. Another one is fear. Then you have fluid volume deficit because of bleeding. So there is no balance between the fluid and electrolyte. See? And then anticipatory grieving because the woman has lost the baby. And last, you have deficient knowledge, meaning you got pregnant, the woman got pregnant without knowing it, that she is already pregnant. Because there are some women who will say, I did not know I was pregnant. How did you not know? You should know because you are a woman. The moment you don't have your menstrual period, then you are pregnant. Unless you have other conditions. See? Okay. Now, the next slide will tell us implementations. Now, what about implementation? Now, this should refer to a continued healthy maternal and fetal physical growth. Now, as I was discussing yesterday with the students in Mohammed Natir University, the fastest organ of a baby starts during fetal period. Meaning that even if you cannot see yet the baby, you have to provide proper nutrition so that the baby will be a healthy and strong baby. Like, for example, the woman should take milk, should drink milk during pregnancy for lactation. See? And then the woman should eat nutritious foods, not junk foods. Especially when the woman is an adolescent and gets pregnant. They are not prepared. Their body is not prepared to be pregnant. So they do not know what is proper and what is improper. Okay? Another one is psychological health of the woman and the family. Sometimes if you are emotional, it affects also the growth of the fetus. Why? Because there is an interruption in the fetal-maternal circulation. So meaning you have to be assured that you have a very good psychological state of mind. See? And continuation of pregnancy as long as possible. Because there are some women who will abort their baby. Okay, now. Okay, what is the outcome evaluation of your implementation? When the patient's blood pressure is maintained within acceptable parameters, meaning that is good, no? Because you can control now your blood pressure to a normal level. The signs and symptoms of hypertension of pregnancy do not progress, no, from preeclampsia to eclampsia. Then the couple is able to cope because the partner should be part of the pregnancy. Then the patient accurately is aware of the signs and symptoms and reports it immediately. Okay. Also important that the patient will adhere to medical treatment and regimen. Okay, so let's go to a complication of pregnancy, which is bleeding. Now, bleeding should be quickly assessed, no? This is done by the woman's overall condition and the amount of bleeding. When the patient or the woman comes to the clinic or to the hospital and complains of bleeding, it is very important that you have to check the vital signs for the blood pressure, the heart rate, the respiratory rate to evaluate stability. Now, also assess the color and characteristics of the blood. No, you should inform the mother to save the perineal pads. No, she is not supposed to throw it away because you will determine how much bleeding has happened. If it is already the dangerous portion of bleeding. Now, what is the emergency response for bleeding? If the bleeding is severe or the woman is in distress, no, activate emergency medical services immediately. Okay? And then provide reassurance and keep the woman calm while waiting for any help. Okay? And then you can help the woman to lie down on the bed and then put her to the side to improve blood flow to the uterus. Because once you put the woman on her left side, this will tip off the uterus and allow continuous blood flow from the mother to the fetus by means of the vena cava. See? Okay, which is a major artery in the body. Now, there should be monitoring, continuous monitoring of vital signs to detect any signs of shock or worsening condition. And then also monitor the frequency and intensity of contractions if the woman begins to go on labor. Now, it is important that as a nurse, we have to document the details of the bleeding and include the amount, the color, and any associated symptoms. See? And you have to locate where the bleeding or the pain is coming from. Okay. Note the time when the bleeding started and any events leading up to it. Now, you can even ask the mother, what were you doing when you started to bleed? How did you know that you were bleeding? And how much time is it left for the big or the amount of bleeding that you encounter? See? Okay, now the appraisal. Communicate effectively with the woman providing information on what is happening to her and what steps can she take to actually comfort her. Now, it is very important that you talk to the mother, allow her to express what she feels, because at this time she is very anxious, very apprehensive. So it is very important that you have to inform, you just maintain your position on the left side lying so that the baby will not be compromised. And you share information with other health team members for coordinated care. Now, you have to remember, IV access is very important because you have to put IV fluid so that you can replace the amount of blood that is lost from the woman. Otherwise, she will go into dehydration, and even worse, complications can set in. Okay. Now, avoidance of medications. No, avoid administering medications without specific medical orders unless directed by emergency protocols. Now, in the Philippines, we have to refer always to the physician so that you are giving the right medicine for the right person for complications. So it's very hard that you are giving medications that can worsen the situation. Okay, so emotional support is also very important. Provide emotional support and reassurance to the woman and her family. Because most of the time, the husband or the partner will be checking on the progress of the woman. See? And you encourage open communication and address any concerns they may have. Because some mothers will request that the husband be called to the room so that they can talk, so that they can make a decision. Okay. Now, there are causes of bleeding. Causes of bleeding during first and second trimester of pregnancy, you have threatened abortion, you have imminent miscarriage, you have miscarriage which is missed, you have incomplete, spontaneous miscarriage, as well as ectopic tubal pregnancy. I'm sure you are familiar with all the terms. Okay, now, in second trimester, this is more complicated because you have gestational trophoblastic disease or the H mole. Do you have cases of H mole here in Indonesia? H mole, the grape-like vesicles. The woman thinks she is pregnant, but when it is under ultrasound examination, there are grape-like vesicles and there is new fetus growing. Yeah. Then you have premature cervical dilatation. In any time of this, the woman can deliver. So the baby can be premature or even it can suffer from intrauterine fetal death. Okay. On the third trimester, we have placenta previa, abruptio placenta, and preterm labor. So these are already the common complications of pregnancy. Now let's go to what happens when there is excessive blood flow or bleeding. When there is blood loss in great amount, there is decreased intravascular volume. So in the spaces of the intracellular spaces, there is a decreased volume of blood. So if there is decreased volume of blood, there is increased heart rate, you have vasoconstriction of the peripheral vessels. And then this will result to increased respiratory rate and feeling of apprehension of the woman due to body changes that occur. No, she is having difficult time breathing, or the heart rate is very fast. No, that no, she will not be able to cope up. Okay, so the process of shock, actually, you call that bulimia. Due to blood loss is the compensatory action of the body. So what will the body do in order to react to the blood loss? So body will become cold, clammy, no, and then there is decreased uterine perfusion, meaning there is not much blood going to the fetus. No, it is interrupted, and the body shifts from interstitial spaces to intravascular spaces is very fast. See, so the volume is decreased, and the blood pressure will continue to fall. So this is very dangerous because the woman can die anytime on the bed. Okay, the signs and symptoms of hypovolemic shock are the following: increased blood pressure, increased pulse rate, you have decreased blood pressure, you have increased respiratory rate, cold clammy skin, decreased urine output. There is no output at this time. There is dizziness and also decreased central venous pressure. Okay, now what are the nursing interventions for this? No? In case there is already hypovolemic shock, do not allow the woman for bathroom privileges. It's a no-no. See, because the patient might expel the uterine contents without knowing it. Okay, and this happens sometimes. No, I have experienced this happening with my own student in the school. No, she took medications to abort the baby, the pregnancy, and then she went on heavy bleeding. Now, it is very difficult because you cannot control the bleeding. So, we cannot be answerable to the parents because that student never told us that she was pregnant. And then she was already doing measures to avoid the pregnancy so that she will not be ashamed, no, by her classmates. Then, after she uses the bedpan, inspect the contents carefully for intrauterine material. So we also have a case of a student who left the placenta in the toilet bowl because she was pregnant and then have it aborted. So in other words, dito na siya. The time when she had the bleeding, she went into labor contractions already and delivered the placenta. Now, note the amount, the color, and odor of vaginal bleeding because it might be that the fetus is already dead for how many days inside the uterus. So save all the pads the patient uses, and this is for evaluation purposes. What else? You have to administer analgesics and oxytoxics. What is the purpose of the oxytoxic? To contract the uterus and to prevent bleeding. Now, monitor vital signs every 4 hours. Monitor urine output closely. provide perennial care, no, and encourage the patient and her partner to express their feeling because they have lost the baby due to bleeding. The number one problem of pregnancy complication also is bleeding because there are already cases who die because of bleeding, especially those mothers who come from the hinterlands, from the mountains, no? And it takes time for them to go down to the doctor in the rural health clinic, so they cannot have the enough time to save the baby. Okay, next. Why? It will not move. There. Let's go to tubal pregnancy, which is ectopic pregnancy. Now, this refers to the implantation of the fertilized ovum outside the uterine cavity. It can grow in the fallopian tube, it can grow in the peritoneal cavity, or elsewhere. So most ectopic pregnancy happens in the fallopian tube. Which part of the fallopian tube does it happen? So they rendezvous, they meet, no, the sperm and the ova meet in the fallopian tube. So the particular area where they grow is the ampulla of the fallopian tube. So other sites will be cervix, ovaries, and like I said, abdominal cavity. Now, so there are 4 parts of the fallopian tube from the ovary to the uterus, but the ovum is fertilized somewhere in the ampulla, in the starting point where they meet. So it grows there, and you know very well that the fallopian tube is not a good place for the fetus to grow. So sometimes it becomes bigger, no, it becomes an embryo, and then later on it will burst. So the bursting motion will cause so much pain for the woman and accompanied by bleeding. Okay, next. So this is an actual footage of ectopic pregnancy after removal. So the pregnancy developed in the fallopian tube and it was removed. No? I have also experienced a student who early in the morning, we were about to go to the clinical area, and I was asking the classmates, why, what happened to her? Why is she late? So much time already. The student had fainted inside the bathroom because of so much pain. So she was brought to the hospital to be managed. She thought she only had appendicitis. And when it was opened, it was found out that she was suffering from ectopic pregnancy. See? Okay. What are the signs and symptoms of ectopic pregnancy? There. Severe abdominal pain, which starts from the shoulder down to the abdomen because the abdomen is filled up with blood. See? Extreme pain with movement of the cervix. The uterus becomes boggy. What do you mean by boggy? Meaning it is hardened. No, it is not soft. Okay? And then there is rectal pressure because the blood contents collect in that area. And the patient begins to vomit. See? So these are the signs and symptoms of ectopic pregnancy. So what will you do if you encounter a case of ectopic pregnancy? You assess the vital signs and monitor bleeding for the extent of blood flow because you need to give fluids later on. Withhold oral fluids and in anticipation for surgery. Now, you cannot allow ectopic pregnancy without any surgery. You have to remove it because that is not the area where the fetus should grow. See? Na-stuck up. No, the fetus is stuck up there in the fallopian tube. Assess the signs and symptoms of hypovolemic shock, which is already dangerous. No? Monitor urine output and administer blood transfusion for replacement of blood loss. Okay, because there is excessive blood loss. Now, with ectopic pregnancy, what happens is there is concealed bleeding. When you say concealed, it is hiding down the abdominal area. So that's why it is very painful. Okay, now it is also important that you record the location and character of pain. See? So like I said, it starts from the shoulders down the abdomen. So administer analgesics as ordered by the physician. No, do not administer without any prescription. Provide a quiet, relaxing environment and offer emotional support. And to prevent recurrent ectopic pregnancy, urge the patient to have infections treated promptly. Usually, it is treated with antibiotics. Okay. So after ectopic, let's go to abruptio placenta. Another cause of pregnancy with bleeding. Abruptio placenta can be categorized into mild, moderate, and severe. Now, with mild, you have gradual onset of mild to moderate bleeding. And then there is a vague lower abdominal tenderness and uterine irritability. And the fetal heart rate are strong and regular. So you think that the pregnancy is still normal within that point because FHR is still good. Now, we go to moderate abruptio placenta. You have gradual onset of moderate dark vaginal bleeding. Now, with moderate abruptio placenta, this is dangerous because this is life-threatening. The mother can die at this category. Then you have continuous abdominal pain, tender uterus that remains firm and contractions, between contractions, irregular and bradycardic. What do you mean by bradycardic? Meaning slow pulse rate. Okay? And there is already possible signs of shock happening. Okay. Now, with your moderate abruptio placenta, there is agonizing onset of prime pain. Now, the abdomen is board-like. When you say board-like, you touch a table and you try to see the consistency. This is how a board-like abdomen will feel in abruptio placenta. We call it Covillier's uterus, Covillier. There is moderate vaginal bleeding, rapid progressive shock, and absence of fetal heart rate this time. So this is already very, the mother will be very anxious at this point. So assess the patient's extent of bleeding, monitor vital signs of the mother, the intake and output, no, or the INO, as well as the vaginal bleeding every 15 minutes. Okay, begin electronic fetal monitoring. That means you have to attach the woman to a fetal monitoring machine. Placenta previa. This is another cause of bleeding in pregnancy, where the placenta implants in the lower uterine segment and encroaches into the internal cervical os, meaning the baby is not able to survive because there is an interruption in the blood flow. This is one of the most common causes of bleeding during the second half of pregnancy. Now, what are the different types of placenta previa? You have low implantation, you have the partial placenta previa, as well as the total placenta previa. With the low implantation, the placenta will develop in the lower uterine segment. In partial placenta previa, you have occlusion already that is happening. It covers a little of the cervical os. And in total, it totally covers the cervical os of the mother. See? And then bleeding occurs nonstop. Now, this is the pathophysiology of placenta previa. See, the lower uterine segment fails to provide as much nourishment for the fetus. Now, because of that, the placenta tends to spread out, seeking the blood supply it needs and becoming thinner, larger than normal. Okay? And the placenta villi are actually torn from the uterine wall as the lower uterine segment contracts and dilates. And this happens during third trimester of pregnancy. Almost, the labor contractions will start. And in internal cervical os effaces. What do you mean by effaces? It opens up and thins out and dilates while the uterine vessels are torn. That's why you have heavy bleeding. Okay. What are the factors that may contribute to placenta previa? You have defective vascularization of the decidua. You can have multiple gestations. Multiple gestations means one pregnancy, you have two fetus developing inside, or 3 or 4 or 5. Then previous uterine surgery, multiparity. Multiparity is pregnancy which comes in several times. Okay? And also advanced maternal age. That's why I said it is not advisable for women to get pregnant after 35 years old because she is prone to complications. Now, what are the interventions? Now, if bleeding occurs, So if the bleeding continues heavily, monitor the vital signs, the intake and output, the amount of bleeding. So you have to document these results, no? Monitor fetal heart rate because you check if the baby is still alive. And then have oxygen ready in case of fetal distress. Because when there is fetal distress and the baby has lower fetal heart rate, then it can be possible that the baby can die. No? And then prepare the patient and the family for a possible cesarean section because you cannot deliver this by normal spontaneous delivery. Then provide emotional support to the family and tactfully discuss the possibility of neonatal death. So the doctor will inform the family that we cannot assure you that the baby is still alive because of so much bleeding, no, that affected her development. Next, we go to pregnancy-induced hypertension. PIH is likewise known as gestational hypertension. This is characterized by high blood pressure during pregnancy. And it typically develops after the 20th week of pregnancy and tends to resolve after childbirth. Now, there are some mothers who will have normal blood pressure after delivery, but most often than not, they cannot recover. Okay? There are several categories of pregnancy-induced hypertension. One is you have gestational hypertension, wherein the blood pressure occurs only during pregnancy and there is presence of protein in the urine, and you call that proteinuria. And then you have preeclampsia. This is more severe than gestational diabetes because gestational hypertension, because this one has damage to the organ systems. So such as the liver, kidneys, no, and proteinuria. The presence of protein in the urine is excessive this time, no, which is the key feature. Now, what is the pathophysiology of PIH or pregnancy-induced hypertension? Now, this one, no, the main cause of pregnancy-induced hypertension is vasospasm. Now, vasospasm will have effects on the three organs. You have the cardiovascular effects, you have the kidney effects, and then you have interstitial effects. Meaning, when there is vasoconstriction, there is poor organ perfusion, meaning not enough blood goes to the fetus. And then this will now increase the blood pressure of the mother. Now, what about decreased or kidney effects? Now, there is decreased glomerular filtration rate. No, you know, the kidneys is like a strainer that will strain our waste product from the body. Now, if there is decreased GFR, it can result to increased serum blood urea, creatinine, and uric acid. So the number one very pronounced result there is increased creatinine. That means the kidneys are not working well. So this is because of the presence of protein in the urine. So there is decreased urine output at the same time, development of proteinuria. Okay. Now, what are your nursing interventions in case there is PIH? Monitor patient regularly for changes in blood pressure, respiratory rate, fetal heart rate, vision, because this can even cause blindness. So much vasospasm, cerebral vasospasm. You have to monitor for the level of consciousness, LOC. You have to monitor for the deep tendon reflex and headache. Once the mother has a headache, it can develop into convulsive seizures. So keep emergency resuscitative equipment and anticonvulsants readily available in case of seizure and arrest. Now, this is very important. Now, the anticonvulsant that is usually administered, I do not know here if you are using magnesium sulfate. Now, in the Philippines, we use magnesium sulfate to control convulsive seizures and have oxygen ready and available because you have to save the baby in case of emergency. Again, carefully monitor IV infusion. The magnesium sulfate should be watched out for toxicity. So you have to be careful with the dosage because if you have given so much, then it can also be dangerous to the mother. Okay. Elevate edematous extremities because edematous here is pitting edema, wherein it is a very severe indentation of the skin. The skin does not come back immediately. And promote venous return, avoid constricting hose or slippers. Okay? Monitor intake and output, provide a dark room for the woman until the patient condition stabilizes. See, why dark room? Because it will not stimulate convulsive seizures. And then there should be quiet room atmosphere. Enforce absolute rest and provide emotional support. Okay. Now, what are the possible complications of pregnancy-induced hypertension? You have seizures, like I said. Once the body will have convulsive seizures, it will be very difficult to control. So you have to prepare a tongue depressor on the bedside because the woman might bite her own tongue. And then maternal mortality in eclampsia is 10 to 15% resulting from intracranial hemorrhage and heart failure. So it is possible that the woman can die anytime on the delivery table. Severe complications in cerebral edema, stroke, abruptio placenta, and also possible for DIC or disseminated intravascular coagulation. And eventually, the fetus will die. See? Okay. Now, let's go to the last topic. Gestational diabetes. Now, I heard that in Indonesia, there are so many cases of diabetes. So, because of too much eating, you have good food and less exercise. See? So, it is a type of diabetes that develops during pregnancy. Complicated case. It is characterized by elevated blood sugar levels in a woman who did not have diabetes before pregnancy. So the condition usually occurs around 24th to the 28th week of pregnancy, where the body's demand for insulin increases and the pancreas is unable to produce enough insulin for the demand. So there is imbalance, no? Okay. Now, what are the causes of diabetes or gestational diabetes? You have heredity. You get it from your parents or your grandparents or from relatives. Then environment can be another cause. It can be infection, diet, like I said, toxin, and even stress. See, because stress is the #1 precursor to diabetes. And also lifestyle habits. No exercise, but it's a lot, especially when pregnant. Okay, how do you assess for the findings of gestational diabetes? 1, there is hyperglycemia. 2, there is glycosuria. What is glycosuria? There is presence of urine in the blood. The presence of sugar in the blood. Okay? Then you have polyuria. Polyuria is excessive urination. Then polyphagia. What is polyphagia? Excessive hunger. No? You are hungry all the time. That's why it is advisable to have small, frequent meals. And then there is hydramnios. No? There is excessive amount of amniotic fluid in the body because the baby later on will be born macrosomia. Macrosomia means more than 400 grams in weight, which is abnormal. Then you have increased incidence of candida infections. Now, this is a concern in the perineal area, and this is also infectious. And the signs and symptoms of micro and macrovascular changes. Now, what is important to note? This can be restrained. This can be prevented. And some women with gestational diabetes mellitus may not experience noticeable symptoms. No, so there should be routine screening for gestational diabetes, typically between 24 and 28 weeks of pregnancy. No, regardless of whether they exhibit symptoms or not. Because early detection is very important so that gestational diabetes mellitus can be managed immediately. Because this can be managed with nutrition, with exercise. You cannot even have medications. Just nutrition and exercise is enough. Okay? And minimize the risk for both the mother and the baby. If there are concerns of risk factors, the healthcare providers, they recommend screening early in pregnancy. So, the explanation of gestational diabetes mellitus is to provide a clear and understandable information for the mother, its potential risk, and the importance of managing glucose levels, especially if you are very fond of eating sweets. No? Okay. Self-monitoring, teach the woman how to monitor glucose levels at home and emphasize the importance of regular monitoring. Now, for nursing interventions, what are you supposed to do? Collaborate with registered dietitian to plan the meal, what to eat for both the mother and because the baby would also need to have the nutritional needs that they that is important for their growth. Education on control of portions and distribution of carbohydrates throughout the day, meaning less carbo, less rice, no? Especially white rice, no? That is recommended for patients with diabetes. Another is regular, moderate intensity physical activity, no? Because this can help, no? Activities like walking, no? Can help control sugar levels. If medication such as insulin is prescribed, provide health education to the woman. Now, oral hypoglycemic agents are prescribed. You educate the importance of adherence to the prescribed regimen, because some mothers will just take one or two but not maintain it throughout the pregnancy. Okay, schedule regular prenatal checkups and monitor for complications. This is very important in gestational diabetes. Another one is individualized based on the specific needs and circumstances of each pregnant woman. Ongoing assessment and collaboration with healthcare providers is very important, for effective care of the woman with gestational diabetes. So in other words, why do we need to understand the concept of pregnancy with complications? So it is important so that it can provide vital well-being of both the mother and the baby. It will guide the healthcare practices, support informed decisions, and contribute to ongoing efforts to enhance maternal and fetal health. See, that's why we study this. In maternal side, complications during pregnancy can pose risk to the health of both the mother and the fetus. So understanding the complications help healthcare provider to prevent risk in the future. Now, though, for the fetal health, it is important because pregnancy complications can affect the developing fetus. And knowledge of these complications enables healthcare professionals to assess and address potential risk on the baby's health, facilitating early intervention if necessary. So, prevention and early detection is very important, see, in gestational diabetes, because awareness of complications in pregnancy allows for preventive measures. You can prevent the condition, and if it is done early. Regular prenatal care, I said, and monitoring can help identify and address the issues before they become severe. So improve the chances of healthy pregnancy and delivery. So this is very important for the nurse. Now, I will end this discussion with care for one, that is love, but care for the hundreds, that is nursing. See? And with that, we end the lecture for this morning. Thank you so much for listening. So it is now time for us for the question. No, she will still translate. You will translate? No more. So you must be good in English because you can understand, no? So
Okay, thank you very much, Professor Barbara, for giving us such informative and interesting presentation. Now we come to the questions and answers sessions. All the audience can ask a question by raising your hand, and all other participants in Zoom meeting can type your question in chat Zoom. Baik, kita masuk kepada sesi tanya jawab. Kepada teman-teman yang ingin bertanya, silahkan untuk mengangkat tangan dan menyebutkan namanya. Pada seluruh teman-teman yang ada di Zoom meeting bisa mengirim melalui chat Zoom.
Siapa yang pertama? Yang pertama tadi.
Okay, thank you for your time. I want to introduce myself to you. My name is Arif Aisyah. I am a midwifery student. Excuse me, miss. I want to ask you, a part of implementations, psychological health of the woman and family. My question is, what is our role as nurse or midwife in the mental health of pregnant woman, where the pregnant mother doesn't receive mental support from her family? And what is the impact or potential problems on the mother and fetus if the psychology is disturbed? Thank you.
Perlu diulang.
Baiklah, saya ulangi dalam bahasa Indonesia. Pertanyaan saya, tadi di bagian implementasi physical mental kesehatan mental ibu hamil itu sangat penting. Nah, bagaimana peran kita sebagai perawat atau bidan dalam menghadapi mental tersebut? Jika mental ibu terganggu dan tidak ada keluarga yang mensupport ibu tersebut. Lalu, apa masalah potensialnya jika mental ibu itu tidak tertangani dengan baik? Terima kasih.
So the question is that the students ask about mental health of the pregnant woman. Mental health of the pregnant woman. So there are a lot of physiological problems in pregnant women. So what is the impact if the mental health of the pregnant women is not they're not support, the family is not support the pregnant woman mental health? And so what is the impact of the pregnant woman if there is something wrong with her mental problems?
Okay, thank you for that question. Your question is, how can you help a woman who is pregnant with mental issues and the family does not support?
On kind of mental issues, but recently that a lot of pregnant women have mental health issues, and a lot of her family did not support their mental health.
Means the woman has mental issues while being pregnant,
Yes.
and then the family does not support.
Yes.
Yeah.
And what is our roles, the nurse roles and also midwife roles to intervention the mental health?
Now, this is an experience for you. You have encountered a woman who is pregnant and then with mental issue. Okay. So, in other words, you have to refer to professional help. Meaning, you cannot handle that your own. You have to refer the woman to social work or to psychiatric help because she might harm herself or the baby. See, because she is not in her right mind and she does not have family to support her. Now, usually, what age is the woman with that kind of problem?
Maybe around 20 or 30.
20?
In 20s.
Yeah. See, because actually, this is what I have noticed here in Indonesia. The women get pregnant and get married very early. No, because sometimes the mind is not yet set for that moment that you will get pregnant. So it will affect the mental capability of the woman in case she is not prepared. So the best thing that we can do is we have to refer for professional help to the proper authorities. No? So if the government can help support the woman, the pregnant woman, the better. No? Because there should be facilities for this kind of women who are pregnant. Do you have facilities here that will put the woman into that safe environment? No.
Oh.
Okay.
Maybe there are some things. There are several non-profit organizations that handle mental
Non-profit.
health. Yeah,
Yeah,
non-profit,
Yes.
but there's little from the government.
Because, like for example, in the Philippines, we have cases like this. No, the woman is not in her right mind, and our fear is that she might hurt herself or even the baby. So there are homes that will accept them, no? Unwed mothers or single mothers, and these are run by nuns. You know what is a nun?
Yeah,
No, they wear it
Yeah.
because the Philippines is made of 80% Catholics. So we have nuns, we have priests, no, who will support them. The nuns will provide care for them. No, once they deliver, they are accepted to these homes without paying. So in your case, you might also refer them to proper authorities so that the woman will be safe and her baby will be safe as getting pregnant. Yeah, maybe because the mental issue is part of non-preparation to being pregnant because very young. No? Good that they do not resort to abortion because they keep the baby, but my fear is that they will harm later on or they will also harm themselves.
All right.
So did I answer the question?
Yes.
Okay. Thank you
Okay.
for that
But
question.
allow me to translate in Indonesia
Yeah.
to the students. Jadi kira-kira begini, siapa tadi namanya? Oh ya, Arifa. Jadi kalau mental health ini kita sebagai peran kita sebagai perawat dan bidan itu satu-satunya cara adalah merujuk kepada profesional. Profesional di sini berarti mungkin bisa ke psikiater atau psikologi. Kenapa seperti itu? Karena itu bisa saja bisa membuat bahaya ke ibu hamilnya sendiri dan juga bisa membahayakan bayinya. Karena mungkin bisa terjadi resiko untuk menyakiti diri sendiri. Jadi satu-satunya cara adalah merujuk dari mungkin rumah sakit biasa itu dirujuk dulu ke rumah sakit jiwa misalnya atau ke psikiater dan psikolog. Nanti dari sana mereka akan mengintervensi mental health-nya. Nanti kalau sudah diberikan intervensi untuk apa ya menenangkan jiwanya, baru nanti kita bisa mengintervensi ke kesehatan ibu dan anak. Kira-kira seperti itu. Oke,
Thank you.
kembali ke moderator.
Okay, any other questions?
Hello, Prof. My name is Irwan Chandra. I'm nursing student grade 1 at Stikes Alifah Padang. I have two questions, Prof. How to detect or avoid bleeding during pregnancy? And how to prepare for a safe pregnancy for a mother with hypertension? That's all, Prof. Thank you. I hope you enjoy in Padang, Prof.
How to prepare? How to read? Oh, how will you prepare a mother with hypertension? Okay. So the question is, what is his name? Chandra. Your question is how to prepare a mother with hypertension?
Yes.
Yes, okay.
And I have two questions, bro. First question, how to detect or avoid bleeding during pregnancy? Bleeding, bro. Bleeding during.
How to avoid bleeding during pregnancy. Is that correct?
Yes, ma'am.
How to avoid bleeding during pregnancy.
Okay.
Avoid bleeding during pregnancy. And the second question is?
And second question, how to prepare for a safe pregnancy for a mother with hypertension?
How to prepare a safe
pregnancy.
Safe pregnancy.
Okay, now I got it. I understand the question. How to prepare a mother for a safe pregnancy with hypertension?
Yes.
Okay, that's a good question. Now, you can prepare the woman for a safe pregnancy if she has hypertension by number 1, proper prenatal care. Number 2, proper nutrition. No, she should not eat salty foods or foods which are high in sodium. No, because that will further increase the blood pressure. And then another one is to continue maintaining the medications that is given or prescribed by the doctor. Because, for example, if she is hypertensive, so antihypertensive drugs are prescribed to these mothers to bring the pregnancy to a full term so that the baby and the mother will be safe all throughout the pregnancy. Okay. Next one is how to prevent bleeding during pregnancy.
How to detect bleeding pregnancy, bro? Sorry, bro.
Prof, sorry, how to detect or avoid bleeding during pregnancy?
How to avoid bleeding during pregnancy?
Yes, bro.
Okay. So, to avoid bleeding during pregnancy, the mother should again go to a prenatal clinic because there they will be able to be examined and tested for laboratory results. Now, bleeding can happen anytime in a woman who is pregnant. But if you have a good monitoring and prenatal care, then it cannot result to bleeding because you are already warned what to do, what activities you need to do when your pregnancy is growing. See? Because bleeding, any form of bleeding during pregnancy, is not normal. So always refer to the prenatal visit that you have. See? Very important that the woman should visit prenatal clinic in order to keep her baby safe as well. See?
Okay, Prof.
Okay.
Okay, thank you, Prof.
Thank you. Any more? Wala na. No.
Okay, next question. Last question.
There, last.
Hello, Prof. Barbara. Nice to meet you, Prof. My name is Erli from nursing major. I'm grade 3 at Stikes Alifah Padang. I have one question, Prof. How to detect or avoid gestational hypertension in pregnancy, Prof? And how to educate the mother when they come to healthcare center? Thank you.
Again. How to detect?
Itu sudah terjawab di tadi yang pertanyaan kedua. Coba yang tadi yang pertanyaan keduanya, the second question. Yang
The question from Shirley, Prof. How to detect or avoid gestational pregnancy, gestational hypertension in pregnancy, during pregnancy, and how to educate the mother when they come to healthcare center.
I think that how to educate mother, the pregnant woman, how to educate pregnant woman to avoid gestational hypertension.
Okay. So it is very easy to educate a woman who is pregnant to prevent gestational hypertension. Number one, she should have monitoring of her blood pressure. No, when I say monitoring of blood pressure, she has to visit the clinic, like prenatal clinic, which is free. And number two, she has to take the medications prescribed by the doctor. And she has to finish the medications, not stop only, not take it only for 1 or 2, but to maintain it. Number three, she should be aware of the food that she takes in, because you know very well as a student nurse that sodium will increase the risk of high blood pressure. So you can tell her, please avoid eating dried fish, and then salty foods. You cannot also eat. Sometimes the mother is an adolescent, let's say, and she is very fond of junk foods that is high in sodium. Now, it accumulates in the body, especially if you do not take much of fluids. So that will end up in hypertension. Did I answer your question?
Okay, thank you, Prof.
Okay, thank you.
Thank you.
There's still a question. Or that one the last.
Okay, all of the audience, we still have quiz. Baiklah kepada seluruh partisipan, kita masih ada sesi quiz. Silahkan join pada link yang akan tayang pada monitor.
Silakan di join Ananda, masih ada 37. Silakan segera bergabung ke kuisnya, enter code-nya. Nanti kuis tiga yang bertanya, tiga yang menjawab terbaik dan tercepat itu akan ada hadiahnya.
Baiklah, kepada para peserta yang berada di aula dan peserta yang berada di Zoom, silakan untuk bergabung ke link kuis yang ada di depan monitor. Nanti akan ada 3 pemenang kuis dan akan mendapatkan door prize. Silahkan kepada teman-teman yang belum join, disegerakan untuk join. Karena yang baru join itu masih 55 orang.
Boleh dimulai saja kuisnya.
Baik, kuisnya akan kita mulai.
and gentlemen, finally we come to the end of this event. Before I close this event, I would like to conclude from what the speaker has had present. Pregnancy complications are health issues that may arise during pregnancy affecting the well-being of the mother, baby, or both. Complications can stem from existing health condition in women developed during pregnancy itself. Medical issues present in women and her family concern can also arise like anxiety, fear, anticipatory grieving. Komplikasi kehamilan merupakan masalah kesehatan yang muncul selama kehamilan sehingga dapat mempengaruhi kesehatan ibu, bayi, ataupun keduanya. Komplikasi ini dapat berasal dari kondisi ibu kondisi ibu yang sudah dialami dari masa sebelum mulainya kehamilan. Beberapa masalah komplikasi yang timbul berupa perdarahan hebat pada ibu, baik itu di trimester 1, 2, atau 3, sehingga dapat mengakibatkan shock hipovolemik. Selain itu, kehamilan ektopik atau di mana sel telur dibuahi di luar, lalu ada plasenta previa atau plasenta yang berada di bawah sehingga menutupi jalan lahir bayi, serta hipertensi yang dimiliki oleh ibu. Maka dari itu penting bagi ibu untuk sadar dan dapat mencegah komplikasi secara dini. Alright, I'd like to thank to speaker, Professor Barbara, for education and inspiration presentation, and all the audience. Thank you very much for being a wonderful participant during this session. Give the applause. Give one more applause for the speaker and for all of you. Thank you very much. I'm Naris Afifa. Wassalamualaikum warahmatullahi wabarakatuh. Giving the next session to our MC.
Well, thank you to the speaker and the moderator. The next session is Professor Barbara will introducing to us about Silliman University. To Professor Barbara, time is yours. Baik, kita lanjut ke selanjutnya itu penyerahan door prize untuk pemenang kuis dan peserta terbaik. Untuk pemenang kuis yaitu yang pertama ada Irma, yang kedua Devi Mailani, dan yang ketiga Putri Suci Rahmadani. Kepada para pemenang disilakan untuk maju ke depan dan kepada Ibu Desi Sarli dipersilakan untuk memberikan hadiah kepada para pemenang. Selanjutnya untuk peserta terbaik, yang pertama yaitu Arifah dari Prodi Kebidanan. Kedua ada Irwan Chandra dari Prodi Keperawatan. Dan yang ketiga Shirley dari Prodi Keperawatan. Silakan untuk mengambil tempat di atas panggung. For the best question.
Okay, so this time we will discuss the PhD program in Silliman University. Now, this PhD program is intended for nurses, for nursing students. So, okay, so Doctor of Philosophy in Nursing in Silliman University. I will have this. Okay, so these are all the subjects that you have to take. But I prepared a specific slide that you will take for the first year, the second year, and the third year. So I will move on to the next slide. Okay. Now, this is an example of the subjects taken by my student. I am the dissertation advisor of the student. So, on the first year, first semester, these are the subjects that was taken. Now, with the corresponding number of units. On the second, now, meaning you don't have to stay in Silliman for the course of your PhD study. Meaning you will stay only for 4 weeks. After your class, you do your requirements and then you can go home. Okay? For the second semester of your first year, these are the subjects that are offered. So this will also have another corresponding units. Okay? Now, after you finish the class and the requirements submitted, you can come back to Indonesia. So this will only take about 3 to 4 weeks, only a month, no, the maximum. Now, we go to the second year. This is your second year now. First semester, we have these subjects. Always, you have to take 4 subjects so that you will be able to finish on time. Okay? So after the 4 subjects taken, submit again your requirements. Okay? And then you wait again for the second semester when you are in second year. So you will take another set of subjects. Okay? So with the corresponding number of units. Okay. So after that, after the second semester comes the third year of the PhD student. So on the third year, you will only have dissertation writing, which is equivalent to 12 units, one subject course. Okay? And then, now this will be depending on the student, if you will be able to present your proposal, you will have the defense. We call that colloquium. So after you have presented the proposal, you can have the revisions of your work when you come home to Indonesia. You don't have to wait for the advisor to tell you to revise. No, you revise it and then you send it through email. Now, once the advisor approves, then you will be now for the ethics committee approval. Now, in our case, we waited for at least December, 2 months because of the break, of the Christmas break. Now, after the revision is done and then approval for the ethics committee, now you are ready for data collection. Now, for the data collection, you will do it yourself and then come back on the second semester. Remember, this is done in the first semester. In the second semester, you will again enroll or register for your dissertation writing. And that will be already your final or your pre-oral or final defense. After that, you pass and you are approved, you will graduate. So it will take you only 3 years to finish PhD in nursing. That is if you work hard for your requirements. Okay? So there is a transient dormitory in Silliman where you can stay and you have to pay either 500 or 300 per person per day. Now, because it is a requirement. Instead of staying in a dormitory wherein you have to pay monthly, now you can have a daily rate. Okay? So we have experienced already one Indonesian student who finished PhD in nursing. So any questions? So that is the end of my discussion with the PhD program.
Prof, is there any requirement for TOEFL score?
Sorry?
Is there any requirement for TOEFL score?
TOEFL?
Yes.
No, we don't require TOEFL.
So you don't require TOEFL for doctoral programs?
Yes.
No.
Unlike Thailand, they required us before. We don't. No
Okay.
requirement for TOEFL.
And how about the ethical approved? Can you? Is there any? Can you permit to use ethical approval from Indonesia?
No, you have to go through the ethical review committee of Silliman.
Oh.
Because you are studying in Silliman.
Oh, okay.
Thank you. Okay, that's all.
How about the tuition fee?
Again, it is with Adi.
Prof, can I ask how to, is there, how many steps to to get the doctoral degrees in Silliman University? How many steps?
What are the steps?
Yeah, oh no, how many steps to get through the doctoral degree?
Understand?
Yeah.
What are the steps in order to get in?
Yeah.
Okay. So the first thing that you will do is you have to send email to the grad school.
Okay.
Because this is outside our role already. It is the grad school that will determine and accept applicants for PhD program.
Okay.
So you will have to write through email and then you wait for the response.
Okay.
Because they will give you a set of requirements to submit.
Okay.
Yeah.
Uh,
Okay, there. Very small.
oh,
Okay.
and
There. Now, good. Now these are the tuition fees for every year of your study. For the first semester, can you please go down? Go down. There. The total amount that you have to pay is 46,000. That is, you do not include the dormitory, the food, no, and of course your fare, no, your plane fare going to Silliman. That is not included there. That is the first semester of the first year. That is the amount of the tuition fee. I do not know how much is that in your currency.
so is that in peso, Prof?
This is in peso.
Okay.
Okay. Can you please move there? Okay. On the second semester, that is the second semester price, you have 45,000 for the second semester of the first year registration. Okay, now we go to the second year level. So for the second year, the first semester is, yeah, please go down. There, 46,105. And then for the second semester, you still have 45,323. Okay, let's go to the third year. Yeah, that one. Okay. Now, when you go to third year, it will be lesser because you are only registering for dissertation writing. See, 32,173. For the second semester, you have even a lower tuition fee because you will now have your final defense. That is equivalent to 29,972. So those are the prices of your tuition fee if you come to Silliman to study PhD.
Prof, so is there any students outside nursing major who took the doctoral programs, such as from midwifery programs? I mean, like, is there any chance of our lecturer from midwifery programs wants to take a program?
I'm sorry, we don't offer midwifery.
Okay.
We do not have midwifery in Silliman. We only have nursing, physical therapy, we have medicine, we have pharmacy and dental course. We don't have midwifery. It is offered in another school.
But this midwifery, they took the master degree in midwife, but they want to continue the doctoral program in nursing. Is that okay?
No, it cannot be because the curriculum is not the same.
Is there any matriculation?
A what?
Is there any matriculation?
Because midwifery is a different course. We cannot offer that.
Okay, so there is no chance from
No.
outside
Because we
nursing
don't have
major
it.
to take the doctoral programs.
We don't have.
Okay. And how many defense examination? Final examination? A proposal defense, how many?
After you have done all the academics, there is only one comprehensive exam of all the subjects. See? So it will run about 2 or 3 days. Yeah. You will have an exam on research. You will have an exam on theories development, curriculum development. So based on your subjects taken.
Okay. What about the proposal defense?
What about?
The proposal
That
defense.
is in the third year of PhD program, and then if you are approved by the advisor, then you can have proposal defense.
Okay.
But before you even think of proposal defense, you have to pass all the subjects.
Yeah, that's absolutely,
Yeah.
yeah. And after proposal defense, how many defense we have to face?
You have pre-oral defense and final defense.
Oh, just 2.
Yeah.
Okay.
Because if in the pre-oral defense you already pass and you are told by the panel committee not to come back for final defense, then you are done.
All right.
But if you are suggested to come back for final defense because there is a procedure that you have missed in your process of doing the data collection and analysis, then you will do another final defense.
Okay.
And remember the defense that you will have, like proposal defense, pre-oral, and then the final defense, you still have finances for that. You have to pay the panel.
Oh, yeah. Okay.
Yeah.
Okay, it's clear. That's
So
all.
many expenses in PhD.
Yes.
Too much.
Yeah. Okay, thank you for the explanation, bro.
Welcome.
Tes. Okay, thank you, Professor Barbara, for the nice information. Now I would like to invite Ibu Desi Sarli, PhD, to please come to the stage to honor a certificate and placard to our speaker and have a photo session together. Now, I would like to invite Ibu Dr. Nurse Asmawati MK as the head of Stikes Alifa Padang to please come to the stage to honor a certificate and placard to our speaker and have a photo session together. To Ibu Asmawati, the time is yours. Ladies and gentlemen, we have reached the end of the event. Hence, as we entering the last session of the event, I am as the Master of Ceremony would like to apologize and send our gratitude to all the participants. Demikianlah acara kunjungan dari Silliman University, Philippines ke Stikes Alifa Padang. Saya sebagai pembawa acara, jika ada kata-kata yang kurang berkenan, saya mohon maaf. Saya akhiri dengan wassalamualaikum warahmatullahi wabarakatuh.